Welcome dear student in our another session. Myself Darshana Sandeep Shinde. Today we deal with the drug acting on the digestive system. In that we see what is meant by purgative or purgative drugs, its type, classification which affect on our digestive system, learning outcomes of this session. After watching this video, students should be able to understand what is meant by purgatives. In that irritant purgatives, bulk purgatives, lubricant purgatives, its classification along with the drug. First of all, we see what is meant by purgatives. Purgatives, these are the drugs which affect on our small and large intestine. Purgatives are also known as the laxative or aperients. It is a medicine or a drug or an agent for evacuating bowel as a cathartic, that is to induce the bowel movement, to loosen the stool, to induce the bowel movement. Then they are most often taken to treat the constipation. Purgative, when taken in sufficiently high doses, result into the diarrhea also. Purgatives act by the digesting elimination of the undigested remaining food in the large intestine and the colon. These are the colons. Then they are available in the oral and or suppository form. It is a drug delivery system that inserted into the rectum or rectal suppositories. These are the suppositories one. Or suppositories are also dissolved into the rectum. Purgative are the drugs which facilitate or accelerate evacuation of the bowel so that the feces may be expelled easily. Then we see the classification of purgatives. Purgatives can be classified into the following three groups. First of all, bulk purgatives, then irritant purgatives, and the lubricant purgatives. Purgatives can be classified into irritant purgative. In that irritant purgative, first of all, it divided into three parts. Irritants. Anthracene group, example of its rhubarb, senna, aloe, cascara sagrada. Then gastric purgatives, example of its croton oil and podophyllum. Mild purgatives, example castor oil, phenolphthalein and bisectodies. Then bulk purgatives, example, it is divided into two parts. Saline purgatives, that is example of its magnesium sulfate, sodium potassium tartarate, potassium phosphate, methyl cellulose is second type of the bulk purgatives. Sodium carboxycellulose, plantago agar-agar. Sodium carboxymethyl cellulose, plantago agar-agar. Then next type is the lubricant purgatives. Example of its mineral oil, liquid paraffin, dioctyl sodium, sulfosuccinate, etc. Then we see irritant purgatives. First class of its anthracene group. This is the active ingredient in the anthraquinone related to imodine. The glycoside is slowly liberated and act in the large intestine. It acts directly as well as after absorption in the small intestine and secretion in the large intestine. It's effective in the both small and large intestine. Onset of action is about 6 to 8 hours. Hence, they are administered late in the evening and they exert their action in the next morning. They are not advised to take in the morning. They are all the types of the purgatives are advised to take at the evening. Then phenolphthalein, it acts on the colon through the small intestine and may also be stimulated one. The onset of action is about 6 to 8 hours. Phenolphthaleins. The exact mechanism of action is not well known, but a small portion may be absorbed and excreted in the bile, which may prolong its action. Phenolphthalein is a drug is relatively non-toxic one. Excessive amount may causes the severe diarrhea, resulting into the fluid imbalance. These are some properties of the phenolphthalein. Next we see the bisectodies or Colax. It has a structural similarity to the phenolphthalein and effective orally as well as rectally. It is not absorbed from the digestive tract and no systemic effect have been reported. The precise mechanism of action is not known, but the stimulation action on the colon appear to be resultant of a direct contact with the wall of the colon. These are directly action on the wall of the colon. The usual oral dose is about 10 to 50 milligram for the adult and 5 to 10 milligram for the children. Then the next irritant purgative is castor oil. Castor oil is a fixed oil obtained from the seed Ricinus communis. Chemically, it is a triglyceride of the ricinoleic acid. When taken orally, it is hydrolyzed by the intestinal lipids to the glycerol and the ricinoic acid. The latter stimulate the persistent movement of a small intestine. Full dose of castor oil produces the purgation within the 2 to 6 hours. That's why castor oil is also known as the cathartics also. Large dose do not produce excessive purgation because most of the excess remain unhydrolyzed, which is obtained or which is absorbed and metabolized like the other fatty acids. The castor oil is relatively a safe cathartic. Its dose is 5 to 15 ml early in the morning before morning breakfast. Then next we see the bulk purgatives. Example of its first category is saline purgatives. These are the salt which are poorly or incompletely absorbed from the gut, that means gastrointestinal tract. Commonly used salts are a number of magnesium salts or various sulfates and tartarate salts. The intensity of action and onset of action varies with the individual salt. Each salt have a different intensity and different kind of onset of action. When given a full dose, the action occurs within the 3 to 6 hours. Then when a large amount of these salts is given, they exert high osmotic pressure and retain large amount of water in the gut lumen, which exert a mechanical stimulus to increase the intestinal peristalsis, and that's why diarrhea can be occurred or this purgative action can be occurred. The efficiency of saline purgative depend on the osmotic pressure exerted by the unabsorbed fraction in the intestinal lumen. Then a small fraction of the ingested salt may be absorbed, but it is radially excreted through the kidney. It's excretion from the kidney one. However, in the case of the kidney dysfunctioning, it may be retained or it may causes the magnesium intoxication. That's why the patient having the kidney dysfunction, these saline purgatives are not preferred one. Thus, in the patient suffering from the severe kidney dysfunctioning, magnesium salt should be avoided as a purgative. On the other hand, in case of the congestive cardiac failure, sodium salt should be avoided. This can be precaution should be taken in the mind while taking the saline purgatives. Then we see the other bulk forming purgatives. These are various natural and synthetic polysaccharides and cellulose compounds. They act by providing the indigestible residue which reflexly stimulate the peristalsis. Some members swell in the water to form an emollient gel which serves to lubricate the passage of the feces. In this way, these other bulk forming purgatives can do their action. The bulk forming agents act within 12 to 24 hours, but sometimes they take more time also. Usually, the bulk forming purgative are avoided for the side effect, but occasional case of the intestinal obstruction, then esophageal obstruction have been reported with this bulk forming purgatives. There are no significant difference between the different bulk forming purgatives, but the natural gums, agar being the gradually dropped out in a favor of the methyl cellulose and carboxymethyl cellulose. Then we see the lubricant purgatives. The principal lubricant purgatives are the liquid paraffin, diethyl sodium sulfosuccinate. Both agents act by the softening of the feces. They work by the softening of the feces without stimulating the peristalsis, directly or indirectly also. Hence, They are used to those conditions where it is desirable that the stool be kept soft or staining may be avoided. For that purpose, lubricant purgatives should be taken for softening the stool without producing or sometimes producing the peristaltic movement. It has two examples, that is liquid paraffin and dioctyl sodium sulfosuccinate. Then we see the liquid paraffin. It is a mixture of liquid hydrocarbon obtained from the petroleum. Hence it is called as a mineral oil. In the intestine, it helps to lubricate and soften the feces. It is not free from the unwanted effect. Being a fat solvent, it may be inhibit the absorption of the fat soluble vitamin K, leading to the hypoprothrombonemia, particularly during the pregnancy. That's why liquid paraffin is avoided during the pregnancy cases. Incidentally, it may be enter into the lungs, lead to the lipid pneumonia, which is more common when the drug dissolved in it are inhaled or applied to the nose and the throats. If a drug is inhaled or applied with the some kind of drug is applied with the in the liquid paraffin or mineral oil, it may be lead to the damage of the lungs, or it may be responsible for the lipid pneumonia. That's why liquid paraffin is not preferred to inhale. Prolonged or not used as a base for the inhalation. Prolonged use in the excessive amount may causes the leakage through the anal sphincter. Then next is the dioctyl sodium sulfosuccinate. It is an anionic surface active agent which has been used in the pharmaceutical industry as an emulgent and as a wetting or dispersing agent for the external application. Ordinary dispersing agent for the external application. Then it was introduced in the 1955 with the claim that it promotes the formation of the soft stool without formation or without stimulation of the peristalsis, just like the action of the liquid paraffin or mineral oil. Then the drug has not been thoroughly studied regarding its action and side effect. It is used in the dose of the 30 to 100 milligram daily in this manner. Then we see the therapeutic uses of the purgatives. These are used for the treatment of the constipations. Saline purgatives are preferred in the case of the food and the drug poisoning, not for the softening of the stool or not for the constipation. Saline purgatives. Then purgatives are given after the anthelmintic therapy. In the anthelmintic therapy, the parasites are removed, or parasites will be the paralyzed ones, and for the removal action, we take the purgatives in the anthelmintic therapy. Use pre-operative in the abdominal surgery. In case of abdominal surgery, our abdomen should be clear one. That's why purgative should be taken out before the pre-operative surgery. In the patient with the anal fissure, piles, cardiac disease, purgatives prove to be useful one. Irritant purgatives should be avoided during the pregnancy as they may cause the congestion. Purgatives are absolutely contraindicated in the patient with the undiagnosed acute abdomen. In this session, we cover what is meant by purgatives. We see the irritant purgative, its classes, bulk purgatives, lubricant purgatives, or its classification along with drug and its action. Thank you very much for attending this session.